And good morning, October 3rd, 2024. I'm Dr. Deuk Machen, CEO and founder of the Deuk Spine Institute. Our patient has back pain. He had a bad fall. He ended up fracturing a bone. We fixed it with cement, and now he has 3 discs that are still hurting him, as well as the facet joints on the left side. These 3 discs are L3-L4, L4-L5, L5-S1. We're going to be doing the Deuk laser disc repair. This is a state-of-the-art advanced treatment. Did you already inject?
Yes, sir.
For discogenic back pain, which is what he has. It turns out that 85% of back pain comes from disc injuries, and that's what this patient has, is disc injuries. So we're going to go in there and repair the disc, get rid of the back pain for him. And he has 3 discs to repair. When we're done, we're going to be ending the broadcast. Shot? Is that it there? And we're going to be back to do his facet joints. So a lot of patients don't just have pain from one source, they have multiple sources, which is why most doctors can't fix patients, because they don't know the multiple sources. They don't know how to diagnose them, how to identify them, and how to fix them. Deuk Spine is different. We've spent years studying back pain and neck pain, and we have been very successful at identifying the pain source, as well as providing treatments that actually work to get rid of pain. All right, if you have questions, feel free to ask. I will start at the L5-S1 disc, as I always do if we're doing L5-S1 during the surgery, and that's because it's the hardest one to get to. And once you get to it, then you can know where your skin incision will be, and you can make the skin incision for the other discs. You can see the fracture on the x-ray. Jordan, why don't you show the audience the fracture? Henry, can you see this fracture?
Yes, we can.
All right, that's the number 4 bone. He crushed it pretty good when he fell back in January. And he's got cement in there. Show us the cement. It's the dark stuff. We started with that, fixing the fracture, AP. But unfortunately, that didn't take away all of his pain. Show us the cement on the AP view. You guys see the cement there in the bone?
Yes, we do.
So we started by treating the fracture, but it didn't take away all of his pain. We realized he had pain coming from the discs and the facet joints. So he didn't just fracture the bone, he also injured 3 discs with annular tears, and then he also injured his facet joints. And all of the discs, the 3 discs, as well as the facet joints, have been causing pain for him now for almost a year. All right, I'm going to make my incision. Did we already do none there? Okay. Because we have our entry point at 5-1, now we can make an incision in the skin. The incision is the size of a 1/4 inch. That's how big you need to do this surgery. This is a new type of surgery. Most surgeons don't know how to do this kind of surgery. They haven't learned it. And truly, Deuk Spine is probably 50 years ahead of the rest of the country in treating back pain. And that number is getting further and further, because other doctors are more interested in providing treatments that don't actually cure pain, but prolong pain, because they can be very profitable treating back pain for people that you keep giving them treatments that cost money, and they stay in pain. They get a little bit of relief temporarily, but the pain keeps coming back. With our treatments, the pain never comes back where we treat. Now, you can have pain in a different place that we didn't treat. There are 30 causes of back pain. So Henry, why don't we start off by showing our audience the 30 causes of chronic back pain that we commonly see.
Of course.
Shot. I'm Dr. R. Deuk Machen with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majin. Thanks for joining us. 1 to 10. All right. Welcome back. You can see from our video that there are about 30 different things in your back that can cause back pain. And they don't all happen in equal frequency. The disc is by far the most common cause. In this case, he had a fracture, so we treated that first, hoping that would take his pain away. We've just tested his disc. How high does that go? 10. All right, so 10 out of 10. We've tested all 3 discs while you guys were watching the video. Jordan, show us the tears in the back of the disc. He's got 3 discs with tears, one there, and one there. That's where his back pain's coming from. You can see also there's herniation and they're pushing on the nerve roots. So we're going to fix the back pain and we're going to fix the leg symptoms. because the back pain's coming from these 3 discs. When we're done with this surgery, we're going to end the stream. We'll be back again shortly after, because this patient doesn't just have disc pain, he has facet joint pain. And the facet joints are just to the side of the spine, and we're going to treat these 3 facets with the Deuk plasma rhizotomy, get rid of that facet pain as well. So this patient has 1, 2, 3, 4, 5, 6 causes of back pain, plus the fracture, which has already been treated with cement a while ago. So we had 7 causes of back pain. All right, we've already done our discogram. We verified that all 3 discs were 10 out of 10 and they're concordant. That means that that's where he gets his back pain every day. So we verified that the discs are the cause of his daily back pain. By the way, we've only lost about 2 drops of blood, and that's all we're going to lose for the surgery. It's a bloodless surgery. The alternative to this would be fusion surgery. So if you've been recommended for a laminectomy, fusion, or discectomy, this is a far better surgery. All right, let's go ahead and put him to sleep. Let me know when I can start. I'll take the question.
Question coming from Raj on YouTube.
Hello, Raj.
Asking if someone has a stiff upper back with back pain and nerve pain, and when they are breathing, they feel a cracking sound all the time. What is that?
Well, that's a great question, Raj. We don't know until we do an examination. But it could be facets, it could be disc, it could be a fracture. We need to look at the MRI, and I would need to do an examination. We can't just tell you what it is based on you talking. That's one of the biggest problems, is people think back pain is diagnosed from an MRI. It's not. Back pain is a clinical diagnosis. It's only as accurate as the doctor making the diagnosis, and 99% of doctors out there don't know how to diagnose it. Only a few of us do. And so you got to go to the right place if you want to be fixed properly. All right, we're going to start at L5-S1. We're passing our dilator. The dilator does not cut anything, it just spreads the tissues. You can see the dilator is at the back of the L5-S1 disc. It's obviously the left side. This is the patient's left side, the right side. If you have questions, feel free to type them up. Remember, we're going to be coming back after this surgery here and doing another procedure called the, Deuk plasma rhizotomy for the facet joint. I could feel the herniation, by the way. It was huge. My dilator just pushed on it, and we're going to go in and use a laser to remove it. Just so you know, we've lost now about 4 drops of blood for the whole surgery so far. I don't think we'll lose more than 20 drops, which is 1 milliliter. If you have open back surgery, you're going to lose anywhere between 50 and 500. We're going to lose 1. So this is relatively bloodless surgery, which is good for everybody, better than open surgery. And the success rate is 99.6% elimination of disc pain. 99.6 is our average. We looked at 500 patients that had back pain and had discogenic pain. We did surgery on about 300, and the average pain relief for the disc was 99.6%, basically 100%. This is the most successful treatment in the world for back pain, neck pain, coming from a disc. All right, let's get the scope on. Just give us a moment. If you have questions, feel free to type them up. There we go. What was the issue? Any questions, Henry?
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is a herniated disc causes back pain?
Yes, I think that's a great idea.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video that the way a disc injury causes back pain is through inflammation happening in the back tear. The tears can happen on the right side of the disc, the left side, or across the whole back. And typically, this pain is very sharp, very localized pain in the lower back, and it can cause your muscles to tighten up. It can happen in your neck the same way. It's identical, no difference. The discs are pretty much the same in the back and neck. They're just a little bit bigger in the lower back. As a matter of fact, the discs are smaller in the neck and they get bigger as you go down to the lowest disc in your back, which is the biggest one, L5-S1. And the discs have basically a center, which is a jelly called the nucleus pulposus, and then they have a wall around the jelly that holds the jelly in, called the annulus fibrosus. Now the wall, or annulus fibrosus, is a ring, and it's 25 layers of collagen and elastin, which is connective tissue. That's what you're seeing right here. This is the annulus, and it's been ripped open through trauma, in his case, falling. And when he fell, he tore these 3 discs and pushed the jelly out into the tear. And you're seeing scar tissue here. That is the body's response to the tear and the jelly stuck in the tear. Your body is trying to heal it, but it cannot heal the tear because the jelly is stuck in the tear. It's kind of like getting a thorn in your finger and you get this red and swollen and painful fingertip right where the thorn is, around the thorn. That's your body trying to get rid of the thorn. It's called inflammation. Same thing happens if you have a pimple, okay? Everybody knows what it feels like to have a pimple on your face when it's really red and swollen and painful. If you just touch on it, put pressure on it, you're going to get more pain. It's going to be localized to right where the pimple is. That's because of inflammation and the nerves innervating your face, your skin. So what happens in the lower back, you get that same type of inflammation that you get on your face, except it's happening in the disc. Now, who discovered this? I did at Deuk Spine Institute. We were the first ones to diagnose it. We're the first ones in the world to treat it. As a matter of fact, 99.9% of doctors don't even know this yet. They're just starting to figure it out. We figured it out 20 years ago almost. And we've been treating it for 20 years. And we've been broadcasting these surgeries for 10 years, trying to get people to understand the mechanism by which a disc injury causes back pain. Most people are in denial. They don't want to believe it, but it's real. And the good thing is patients who come here with this problem and get our surgery, they become pain-free from their discs. Now they may have other causes of pain. For example, you saw the video, right, Henry? The 30 causes of back pain.
Yes, we did. Yep.
So you don't just have discs that cause pain, facet joints can cause pain. So if we treat the disc only and a patient has disc pain and facet pain both, then we only treat the disc pain, they're still going to have facet pain. Same thing with the piriformis muscle. We see a lot of people with piriformis muscle tears that are inflamed, painful, and they cause horrible pain in the top of the buttock, kind of the hip area, in the back of the hip. And most doctors don't know how to diagnose it. So the patients just live with that pain, and then they have to go to pain management. They get pills, they drink alcohol or take drugs to treat their pain. They get shots like epidurals that don't work. And there's a lot of money spent on those treatments, a lot of time spent on those treatments that don't work. And that's what we're trying to do, is educate the public about treatments that do work. The ones that we've developed here at Deuk Spine are new, novel treatments. Nobody else has ever done them. So if you think about it, back pain is the most common problem people have. And nobody knows how to fix it. But we figured out how to fix the back pain here at Deuk Spine, out of necessity, because other doctors don't know how to fix it. We get a lot of patients coming here. We've figured out the source, and then we figured out the best treatment based on the source. Let's show our audience the treatment of discogenic back pain called the Deuk laser disc repair, which is what this patient has and what we're doing right now.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Excellent. You can see from our animation that the tube we're using, which you can see is a metal tube, we're looking down the center of it, and the wall of that tube is what you're seeing around us, is the metal. That's protecting all the tissues and nerves around us where we're operating. And we're operating in the middle of that tube. And I'm removing the herniation in the middle of the tube, which is the herniation causing his pain in his back and leg. I'm using the laser to do that. Now, there is no other instrument that works as well as a laser. The laser is the only one. Any other instrument you try doesn't work well at all. It doesn't do the job. You need the laser and the laser energy. You can see the laser fiber is glass. That's the laser fiber. It's 1 millimeter wide, 1 millimeter. That's tiny. So why are you able to see it so well? The reason is this camera and the lens of the endoscope magnify the view, so you can see it really well. It's magnified. Okay? That's important. You can't do this surgery without the endoscope. You can't do this surgery without the laser. They're both absolutely essential parts of doing the surgery properly. Now, lots of doctors will try to do shortcuts and they'll try to do different versions, but the other versions don't work. And the reason is that these pieces of equipment are very expensive, so most doctors don't want to buy them, most hospitals don't want to buy them. They don't see a value. They think they can do something else and it'll just be just as good, but it's not. We've tried lots of other techniques, they don't work. This is the best. It's the one that works the best and gives the best results that are consistent. Okay, I think we have some more questions. We're almost done with the L5-S1 disc repair. We're going to go to the L4-5 next. But this is all scar tissue and pieces of herniation. You see this? A little piece of herniation there.
Yes, we do.
All right, you have a question, Henry?
Yes, this question coming from Dan on Facebook.
Hello, Dan.
Asking, is it the herniated disc material that causes the inflammation and the inflammation pinches the sciatic nerve, or can the herniated disc material by itself pinch the sciatic nerve?
Great question, Dan. Yes, it is the herniated nucleus pulposus that's stuck inside the annular tear that causes inflammation. There's a piece of herniation right there. It's actually too big to come out on its own, I think. Maybe we got it. Yeah, I got it. So the nucleus material wedged into the tear is what causes inflammation. The inflammation is not in the nucleus, it's in the annulus, which is the ring. Remember, the nucleus has no blood supply, and you need a blood supply to have inflammation. So the outer half of the annulus ring, outer half, is what has blood supply and nerves, and that's where the painful inflammation occurs. As far as what causes the sciatic symptoms, if it's coming from a disc injury like this, it is most commonly due to the inflammation spreading onto the cover of the nerve, called the dura, causing inflammation of the nerve rather than pressure. It's not a pressure issue. Sciatic pain does not come from pressure on the nerve. It comes from inflammation of the nerve sheath, the covering around the nerve. So it's one of the misnomers, something that a lot of people don't understand, including doctors. There's the tear right there. This is the outermost part of the tear. Okay, we're almost done with this disc. Everybody thinks it's pressure on the sciatic nerve that causes sciatica. It's not. It's wrong. I discovered it's not pressure, it's inflammation. And how do you know? Well, it's quite simple. If you look at people with sciatic pain, many of them have very small herniations or no herniation at all. They just have a tear with a bulge, which is a small herniation, by the way. And they have horrible sciatic pain. So how is that possible? It's possible because it's not pressure on the nerve. There is no pressure on the nerve. You'd see it on the MRI. It's inflammation affecting the nerve root, L5 nerve root or S1 nerve root. Great question.
We have another question coming from Bavesh on YouTube,
Hello, Avesh on YouTube. Welcome to our live stream.
asking, if I understand the surgery correctly, then the dilator goes all the way through the disc to the disc tear. Does the dilator not cause damage to the disc?
So the dilator goes into the disc tear that's already damaged. We're not creating any new damage. We're going through a hole that's already there, created by the herniation, the trauma of the herniation. We're not creating a new hole. We're going through a hole that's there already, called the annular tear. It's a good question. All right, Henry, why don't we show our audience what we're going to do after the Deuk laser disc repair is completed at 3 discs. So we're finishing up the first disc. We're going to fix 2 more the same way, and then we're going to move on to the facet, treating the facet pain, which this patient has. And that procedure is called the Deuk plasma rhizotomy. We're going to stop this stream when I get done with the last disc, and we're going to start a new stream for the Deuk plasma rhizotomy. So Henry, let's show the audience, why do facet joints cause pain?
Copy that.
All right, great. You can see that the facet joint can be injured at the same time the disc is injured through trauma. And when it's injured, you get a tear in the capsule around the facet, which is soft tissue, and those capsules are innervated. They have little nerve fibers in them. What happens is the body tries to heal that tear through inflammation, but it never heals. And instead of healing and the pain going away and the inflammation going away, you get this cycle of chronic inflammation in the facet joint, which then causes facet joint arthropathy, which is arthritis of the facet joint. So why don't we show the audience how we treat, the best way to treat facet joint pain, which is our procedure that I developed, and I've patented it in the United States and eventually Europe. This patent has allowed us to do these treatments, but we're the only place you can get the treatment done. Let's show them the Deuk plasma rhizotomy.
Copy that.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see we use plasma, which is a high energy state of electrons, to destroy pain nerves around the facet joint. The procedure is called a rhizotomy, but it's done in a special way that we have pioneered here at Deuk Spine, and we have a tool to do it that is patented, and we're able to cure facet pain permanently, whereas other doctors cannot. They'll do medial branch block or RFA, which are temporary treatments. You have to keep coming back, getting it done over and over again. We have a permanent treatment, but we're the only ones in the world that do it, and I pioneered that treatment as well. Between disc pain and facet pain, folks, you've got 95% of chronic back pain. Okay, so for the guy that asked the question earlier, are we damaging the disc going in? No, we just went through the tear. You can see the tear on the x-ray. The dye is leaking out. Jordan, show us on the x-ray. Henry, take a look at the x-ray.
Yes, sir.
Show us the tear on the disc above. Okay, there's the tear. It's a black line. That's what we're going through, folks. We're going through the tear. We're not creating any new injury to the disc. That's why this procedure is so amazing, is it fixes the disc problem without causing any damage to the body whatsoever. The only thing that's damaged is the skin. We cut the skin, that's it. Everything internally is preserved. We don't do any muscle damage. We don't do any bone removal like they do in a discectomy or laminectomy. We're not taking your ligaments out, your supporting ligaments that you need. But all those other surgeries that are offered around the world, they destroy your normal part of your spine to try to get to the disc, but we don't. That's the beauty of endoscopic transforaminal surgery. All right, look at all the inflammation. It's pink. You guys see the pinkish color?
Yes, we do.
And the blue is the herniation, the nucleus. And the white stuff is either annular fiber or scar tissue. Two things are white, annular fiber and scar tissue. The other thing that's white are nerves, but you're not going to see the nerves because they're outside of the sleeve, the nerve roots. And the nerve roots that are pain nerves in here are unmyelinated. They don't have myelin or white stuff around them, so they're virtually invisible to the eye. You can't see them. They're the same color as the rest of the tissues, and they're very small, microscopic. All right, you have some more questions?
Yes, we do. This is coming from Francesco on YouTube.
Hello, Francesco. Welcome to our live stream at Deuk Spine Institute.
They asked, for those of us heading into pain fellowships, how would we learn and get proctoring for endoscopic ablation of the medial branch nerves? Does your technique avoid multifidus deinnervation?
Yes. Yes, it does. So, first of all, endoscopic ablation of the branches of the medial branch of the dorsal ramus, we don't recommend that treatment. We tried it in the past. It's not very effective. You'll see when you try it. We don't recommend it. We don't teach it, but we can do it. We have the endoscope, obviously, and the ability. Our treatment is far more elegant, safer. It's called the Deuk plasma rhizotomy, and that is the treatment of the future. How do you get trained on it? We'll be eventually training people in the future how to do it. You just have to contact Deuk Spine, and then we would set up training here. We're not ready to do the training just yet, but we will eventually do that for pain doctors. Great questions.
At this moment, no current questions.
So we tried the endoscopic, but you'll see it's very difficult to visualize. the soft tissues keep getting in the way, and you rarely ever find the nerve that you're looking for, and it will take you at least an hour or more to do the procedure. It's very, very challenging to do, and of course very expensive to do, because you have to have an endoscope and all the other supplies that are needed. The treatment we do, the Deuk plasma rhizotomy, is far less expensive and much faster and safer and better. It has much better results than endoscopic. Okay, so we are in the tear now at L4-5, and what we're seeing here, the laser is removing, is mostly scar tissue around the herniation. The herniation is that light blue color. It's a baby blue. It's very hard to see, but the blue is a stain that we use that stains the nucleus pulposus, the herniation. You have scar tissue. You have some calcium here called dystrophic calcification. We have small painful nerve fibers here. We have inflammation in here. We have annular fibers as well. This right here is annular fibers. You guys see the white stuff?
Yes, we do.
So you got to clean out all of this junk to get the disc to heal properly. Now the reason it's so white is there's no blood supply, right? Scar tissue is white. It's called mature scar tissue. It's white. There's a piece of herniation. And the scar tissue is white because it doesn't have any blood vessels. It's avascular. We call it avascular, without blood vessels. And the annular fibers are white because they're avascular. The herniation is blue because it's stained. The stain will bind to degenerated nucleus pulposus, not to annulus, not to scar tissue, not to bone, not to nerves, not to blood vessels. The only thing our stain binds to is the herniation that is degenerated. Now, if it's a brand new herniation that just happened a few days ago, it will not stain blue either, because you have to have acidic acid, basically what we call acidic nucleus for the stain to bind. And you don't get acidic nucleus until you get inflammation causing it to degenerate. Look at that. That's a piece of herniation right there. This procedure is called an annular tear debridement, or annular debridement for short. We're cleaning out the herniation that's stuck in the tear because the body cannot remove this itself. It's tried for years in his case, and it's been unsuccessful. So we're helping his body heal naturally. That's what we're doing. There's more of the tear right there. You can see the torn fibers.
Yes, we do.
And there's a piece of herniation right there, the blue stuff, stuck on the tear. It's stuck there because of scar tissue from the inflammation. The only way you get scar tissue is through inflammation and then healing from the inflammation. It's your body's way of trying to heal soft tissue. It uses collagen and elastin, which is what scar tissue is, mostly collagen. Any other questions?
At this moment, no current questions. So in the meantime, we have shown pretty much all of our animations. Why don't we show the audience of what is a microdiscectomy and why you should avoid that?
Yeah, I think that's a great idea. We have a nice animation showing you the microdiscectomy surgery, which we don't recommend anymore. It's invasive, destructive. It damages your normal spine and makes it weak and unstable, so you have future problems. Most surgeons recommend it because they know that it's not really going to work or last. There's a piece of herniation. You see that?
Yes, we do.
And they know that you're going to come back and need a fusion. They like fusions. Fusion is the highest paying surgery in the world for surgeons. So unfortunately, a lot of surgeons want to do fusions because that's where they make the most money. So they're going to recommend fusions. They're going to recommend laminectomies because laminectomies almost always lead to fusions. If you're having a laminectomy, you're probably going to have a fusion just a year or two later. And people need to be aware of this. The surgeons won't tell you this. The surgeons don't know how to do these laser surgeries, so they want to recommend what they know how to do, even though it's not what's best for you. That's why we do these videos, so people can learn the truth about spine surgery, and what's the best spine surgery in the world right now is the one you're watching. Now, I used to do fusions all the time before I knew how to do laser surgery, before I invented this technique. And if fusion is the only treatment available in the world to you, then that may be a good option. But you have to make sure your surgeon is treating the right levels. Because if you only treat 1 or 2 discs when there's 3 discs that need to be treated, you're still going to have pain. And the surgery will fail because you'll be in worse pain afterwards. You see these stories on the internet all the time. All right, let's go ahead and show them how a microdiscectomy is done and why they should avoid it.
Copy that.
A large incision is made. Muscles are torn from the spine. Substantial bleeding occurs due to muscle trauma. Normal, healthy bone is removed to access the herniation. Stabilizing ligaments are removed in order to access the herniation. An incomplete portion of the herniation is removed. Dense scar tissue forms. Weakened bones can fracture, leading to instability and pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Great, so we're almost done here. I'm just pulling out a few more pieces of herniation out of the tear. And you can see from the video we just showed you that this microdiscectomy or discectomy surgery that's recommended to patients all over the world for disc problems and stenosis, it's not a good surgery, folks. Number one, it removes your normal bones and ligaments, weakening your spine. You will have to come back, most likely, and get a fusion done or more procedures done, pain management. We don't recommend it for that reason. Our treatments are permanent fixes to pain. The second problem is that it does not clean your tear like we're doing right now. You see how much time we're spending with the laser, cleaning out the tear, getting rid of all the stuff in there. This patient's body will literally seal this tear off. They will heal this when we're done with this laser surgery. However, if you do a microdiscectomy, the body cannot heal the tear because you never took the herniation out that was stuck in the tear. They just take out the herniation that's outside the tear, that's pressing against the sciatic nerves. But with this surgery, we're removing the herniation that's inside the tear as well as the herniation outside the tear. And we're doing it without taking your ligaments and bone out. This is a much better treatment. Someday, when other surgeons know how to do this and they're able to do it, they're going to offer this surgery to their patients, not a microdiscectomy. Microdiscectomy will go away. It will be a treatment that goes away, just like telephone booths, right? How many telephone booths do you see nowadays? But for people that grew up in the 80s and 90s, there were telephone booths everywhere. At every grocery store, every gas station, you could get out of your car and make a phone call. You put in some quarters or dimes and you make a phone call. Well, now there's no telephone booths because we have cell phones. So technology advances, and unfortunately with this treatment, most surgeons cannot do it. It's beyond their reach because they don't have the equipment, they don't have the training, they don't even know it exists. This is a futuristic treatment. But you guys are seeing it because we're broadcasting it. Every week we broadcast it when we do these surgeries. All right, we're just about done with this disc. I want you to appreciate the fact that the annular tear has been cleaned, and now what's left is about 3 millimeters, and that's it, okay? The nerve is up there somewhere in that fat, but the tear has been debrided. The epidural space is here. You can see some veins and some fat, but otherwise it looks good. I want to hit it one more time with a laser. I'll take your question.
This question coming from Frank on YouTube,
Hello, Frank.
asking, is this treatment expensive if someone doesn't have insurance?
Well, Frank, I don't know how to answer that question. It's a great question. But the answer is, what's life like living in pain? That's expensive. You know, living every day and with back pain, keeping you from working or hobbies or enjoying life, suffering. I think suffering is expensive. So is this expensive compared to a lifetime of suffering? No. It isn't cheap. It's not like a few $100 surgery. And we are trying to get the insurance companies to cover it. We've had well over 150 payments by insurance companies over the last 3 years, but a lot of them will refuse to pay. And we have to fight them. When I say we, I mean you and us. We have to fight them to get them to pay. So it just depends on your insurance, how good your insurance is, and how good your plan is. There are thousands of insurance plans in the United States. Even if you take Blue Cross Blue Shield or Anthem, they have 1,000 or 5,000 plans. You know, every plan is different. Every plan covers different things, different benefits. So they do it on purpose to make it very confusing. But every state has different laws about what the insurances have to provide by law. So it's very complicated. So the long and short answer is, we don't know if your insurance will cover it until after the surgery's done and we bill them. And if they don't pay for it, we fight them to get them to pay. And even if that means we have to go to trial or take it to a judge to make a decision, we would. It's worth it. This surgery is worth the investment you would put into it to get well. Otherwise, you just live in pain the rest of your life. And I've seen people like that. They've wasted their whole life living in pain. 10, 20, 30 years. We get a lot of patients with this surgery that they contact us and say, you've saved my life with your procedures. I can live again. I can do things. I don't have pain anymore. You can see it in their face. The pain is gone. Their wrinkles and creases go away. Pain is horrible, and this treatment is the best in the world for getting rid of back pain from a disc. Okay, last disc, number 3-4. Shot, that's it. So I'm bringing the dilator in. It's going to spread the tissue, just like putting a little safety pin through your shirt. It doesn't cut your fibers of your shirt. It spreads them apart and goes between them. So everything under the skin is fibrous, okay? The soft tissues, connective tissues are all fibrous. They're made out of collagen fibers, elastin fibers, just like your shirt. And by using the dilator, we spread them apart. Now, to get into the disc, we don't have to remove any bone or ligaments, so we're leaving the spine intact and strong. That's what we want. We don't want to we don't want to weaken the spine. Let's see. Yeah. We want the spine to remain strong. We call it integrity. We want to preserve the integrity of the spine. Discectomy laminectomy, fusions, artificial disc, all those surgeries, every other surgery besides this on the spine will weaken your spine because they have to cut out ligaments and bones to get down to the disc. We don't. Now, I didn't pioneer this procedure, transforaminal endoscopic surgery. This was pioneered by Dr. Parvis Kambin. He's an Iranian orthopedic surgeon back in the 80s and 90s. He was the first one to do this type of surgery. And my teachers that taught me learned from him. And the technique has been improved tremendously since he originally discovered it. But he realized that there's a way to get to the disc problem by going from the side rather than through the middle of the back. If you notice, back surgeries are typically done through the middle of the back. There are some exceptions, of course, different types like XLIF, OLIF, and ALIF. Those are fusions. But the vast majority, look at that inflammation. The vast majority of back surgery is done through the middle of the back, which is destructive to your body, totally destructive. It weakens your spine, weakens your muscles permanently, and puts in scar tissue where the muscles were that they destroy. So it's also very painful to have traditional back surgery. Oh, look at the herniation. Turn the light on. We just pulled out a nice size herniation. Can you see this, Henry?
Yes, we can.
All right. Not the biggest I've ever taken out, but not too bad. It's the biggest one we've taken out of him. It's about 2 centimeters long. That's one of many that we'll take out. Each disc has about 30 herniations on average. Any other questions?
Yes, with this next question coming from Texas 3M Cut on YouTube.
Hello, Texas. Welcome.
Saying, hello, doctor. I am a neurosurgeon in South Korea.
Oh.
First of all, thank you all for your educational live surgeries. My question is the laser tip different from the conventional ablation tip used in arthroscope, brand name ArthroCare?
Well, doctor, first of all, thank you for joining and thank you for your comments. My wife is South Korean. She comes from Seoul. Her name is Sun. And I learned my cervical endoscopic technique from 2 great Korean neurosurgeons, Dr. Sang-ho Lee at Woodydal Hospital and Dr. Gun Choi. They were my teachers 19 years ago. And I learned the cervical endoscopic transdiscal approach from them, and I brought the laser in. The laser, I don't know what the laser fiber that, he said ArthroCare?
ArthroCare, yeah.
I'm not familiar. This is the Boston Scientific laser fiber. And the laser I use is a holmium YAG laser made in Israel. It is the Luminous VersaPulse. Luminous VersaPulse. Holmium YAG medical grade laser. It's the best laser in the world for this application. Everything we're doing is FDA approved by the United States FDA. The laser fiber is approved for the spine, for disc treatment, and the laser itself, the machine, is also approved for this application. So it is I don't know, I think that gives you everything you may need, but it's the Boston Scientific laser fiber.
And we have another question.
Sure.
Coming from Lanu on YouTube.
Lanu, I was wondering when you were going to ask a question. Welcome, Lanu.
Asking, is a herniated disc considered life-threatening condition?
Is a herniated disc considering a life-threatening condition? Well, it can be, because the pain from the herniated disc could cause people to commit suicide, which happens all the time. And that's one of the things we want to change. People living in chronic pain that cannot find a way out, they'll drink alcohol until they destroy their body with their liver or their brain. They will do drugs. They'll take powerful narcotics called opioids. Opioids are dangerous. So the pain from a herniated disc can be life-threatening, absolutely. And in Florida, where we do our surgeries, the Florida law says that a life-threatening condition is one that causes severe pain or threatens the actual life or threatens the limb, which is, the function of the arms and legs, which is nerve damage we're talking about, right? So herniated disc in the neck can cause spinal cord damage, myelopathy, which could threaten your life. So yes, I would say certain conditions that are a result of a herniated disc can be life-threatening, particularly the treatments that people do, which are dangerous, such as opioids, alcohol, or even suicide. Yeah, good question. Okay, this is it. We're just about done. If there's any other questions, I'll take them, but we're going to end the live stream and we're going to go on to the facet joint treatment next. Remember, this patient doesn't just have disc pain, he has facet pain. So we're going to end the disc treatment, which is the Deuk laser disc repair. We're going to move on to the facet treatment next. So rejoin our live stream and you can ask me questions. Now I'm going to tell you, at the end of the facet treatment, I will come and answer your questions face to face. So if you join us on the next live stream, I will come and answer your questions face to face. But for this live stream, I can't. We're going to stay here in the operating room and do the next part of this patient's surgery, which is the facet treatment. There's a big piece of herniation. You guys see that? Kind of stuck there in the tube. We take all these herniations out. I'm going to grab that one and take it out. All right, good. So this is the L3-4 disc. You can see it looks pretty good. It did not take me as long to do this disc as the other ones. And if you have a question you want me to answer now, I'll take it. Otherwise, rejoin our live stream in a moment after we bring back the live stream to do the next surgery on the same patient.
Yes, we have a comment just coming from Texas 3M once more on YouTube saying, thank you for the information, doctor. I am familiar with the doctors at Wuredal Hospital. Unfortunately, Korea's insurance do not cover the laser tip nowadays.
Yes, I understand. Well, doctor, this is all I can say. If you're a physician like I am, my father was a doctor, my brother's a neurosurgeon, I believe in one thing: do what is very best for the patient. Always offer the patient the very best. Now, some people will say they don't want to pay for the surgery, and that's fine. That's their choice. But I'm always going to recommend the best treatment for the patient, not the best treatment for the insurance company. I didn't become a doctor to serve the insurance companies. I became a doctor to serve my patients and their needs. So all of our surgeries require payments, and we're not as busy as we could be. We could be 100 times busier if the insurance would pay for everything we did, but they don't. And the reason the insurance doesn't want to pay is that they realize this surgery works, and they don't want to pay for surgery that works. The reason for that is that people will find out and they'll come and they'll spend the insurance company's money to get fixed. The insurance company will cover surgeries that don't work, surgeries that are dangerous. People know they're dangerous, like fusion. And the reason is the insurance company does not have to say no to the patient. The patient will already say no. So they don't look like the bad guy that they are. Insurance companies are bad in the United States, and it sounds like they're probably bad in Korea. I'm sure that it's the same insurance companies. And the insurance companies run the world. They decide what they're going to pay for, but they don't decide what I do. And they don't decide what my patients do. My patients decide and I decide together. All right, thank you for joining us. I'll be back in a few minutes. We're going to end this live stream. We're done with the third disc, and we'll be back. And good morning, October 3rd, 2024. I'm Dr. Deuk Majin. I am the CEO and founder of Deuk Spine Institute, the pioneer of the Deuk laser disc repair, annular debridement for discogenic pain, as well as the Deuk plasma rhizotomy for facetogenic pain, the sacroiliac joint Deuk plasma rhizotomy for sacroiliac joint pain, and the piriformis, Deuk piriformis release to release piriformis muscle tears that are painful. Okay, our patient just had the lumbar Deuk laser disc repair, L3-4-4-5-5-1. You can see the dye that we injected during that surgery in the disc space. There's L3-4 dye, L4-5, L5-S1. And take a look at the cement in this L4 body. This patient had fallen, had a compression fracture of L4. We treated that first with kyphoplasty. It got rid of a little bit of the pain, but he still had severe back pain and going down his left leg with some radiculopathy from stenosis and compression of the nerve roots at L3-4-4-5-5-1 in the lateral recess and neuroforamen. So we just finished the DLDR. Now we're going to treat his facet joints. So we need to get to the facet joints at L5, L4, L3. I can see the transverse process of 3. I can see it at 4. And I can almost see it at 5. And then I can see the S1. So we're going to destroy 4 pain nerves on the left side. You guys ready? All right. I'm going to be a little higher. Shot. So I'm just lateral and inferior to the pedicle of L4 on the left side. And I think right there would be a good entry point. We're going to numb up the skin. Just go through there. And we're going to numb up the skin, and we're going to, as you come out, inject. Yep, good. Knife. I'm going to make a 4 millimeter incision. 4 millimeter. It's tiny. It's a Band-Aid incision. Now through this 4 millimeter incision, now I know why my lasers don't work. What did that laser ever do to you? Sorry, through a 4 millimeter incision, we're going to go in and basically destroy or rhizotomize 4 pain nerves. That will get rid of this patient's facet joint pain permanently. And this technique was pioneered here by me at Deuk Spine. We've been performing it for 3 years. We've performed it now on the spine, the facet joints, the SI joint, and hips and knees and shoulders. And it works great for arthritis of the knee, hip, and shoulder. All right, so show us the tip of the probe. You guys see that?
Yes, we do.
That is exactly the most perfect spot you can be to get rid of the pain nerve to that joint. All right, one down. Next one. Do we have any questions? Feel free to type them up. Shot?
At this moment, no current questions.
All right, then let's show the audience how is it that facets can be so painful. Henry, what makes them so painful?
Copy that.
And the answer is inflammation, but you'll see it in just a moment. And welcome back. You can see from our animation that the way facet joints cause pain is arthritis, which is inflammation of the facet joint, specifically the capsule. The capsule is the part of connective tissue with nerve fibers in it that wraps around the facet joint. And when you have a trauma to your back, to your spine, what happens is you rip open the capsule. And that happens in knees and shoulders and hips and facets, and it even happens with the disc, right? We call it an annular tear in the disc. And we just finished fixing 3 annular tears that were painful. Now, in this patient, he has facet joint pain at 3 facets, so we have to destroy 4 nerves. And the nerves are called the medial branch of the dorsal ramus. Medial branch of the dorsal ramus. That's what these nerves are called. They come out of the neuroforamen and they innervate the facet joint. The only thing these nerves do is carry pain signals up to your brain. Literally, that's all they do. They're pain nerves. And Sometimes when we do this procedure, we're going to get rid of the pain permanently in the facets. But also people will have a little bit of numbness in their skin over the facets because the skin nerve runs with that nerve. Okay? Shot. We're pretty much done. Look at the position of the tip. That is perfect for where the L5 dorsal ramus runs up to innervate or down to innervate that joint. Sorry, the L5-S1 joint. So perfect positioning. I can actually feel the pain nerve. I'm bouncing on it. And the best way to destroy it is what I'm doing. It's called the Deuk plasma rhizotomy. I pioneered this technique here at Deuk Spine 3 years ago. We've treated hundreds and hundreds of patients, successfully getting rid of their pain. We're done. Let me show you the incision. It is tiny, 4 millimeter, and the amount of bleeding we get is minimal. You can see we had probably 5 drops of blood. With the laser surgery, we had another 5 drops of blood, but there's no bleeding with the surgery. Okay, there's the incision, 4 millimeters. And again, I pioneered this technology to destroy pain nerves. Thank you, Luis. Good job, everybody. If there's a question, I'm going to come and answer them, so type your questions up. We're going to take these staples out tomorrow, but we leave them in overnight, and we put a Band-Aid on tomorrow with steri strips. So it's outpatient surgery. This patient will go home right now in about an hour. He'll have a driver to take him home. Then he comes back in the morning for a quick checkup. We have people from all over the world that come here for this treatment. We've treated professional athletes. We've treated gas station attendants and regular people, lawyers, doctors from all over the world. Nurses, actually even billionaires. They come here and they get this treatment because they can't get it where they live. Deuk Spine is really exceptional at getting rid of back and neck pain. Okay, I'm going to come and answer your questions face to face. Feel free to type them up. And in the meantime, Henry, let's show them how the DPR works. I'm here with a gentleman who came to the Deuk Spine Institute with horrible back pain, pinched nerves, symptoms down your leg, weakness, numbness, and using a walker. He's been struggling now for quite a while. You had the Deuk laser disc repair done yesterday in the morning. We went in with the laser and we cleaned out 2 discs that were really causing pain in your back. They were herniated and starting to degenerate. How do you feel today?
10,000 to 50,000% better. Absolutely wonderful. I can't even, it's hard to explain. Going from not being able to walk 5 feet to being able to almost just walk around the block. It's one day, I mean, it's 24 hours. It's incredible.
And when did you realize you had this relief on your back?
Yesterday, when I got home and got settled down, and there was no pain. There was no pain in the back. There was no pain all the way down the leg to the big toe. It was like, where'd the pain go? It just dissipated. And that's after surgery. So usually you feel like there's surgery, there's gonna be some pain. No pain. I can't even explain it.
Well, you're doing a good job. What was life like before you had the Deuk laser disc repair surgery?
I didn't want to live this way. There was no way I would never want to live that way. You just, no, never want to, no. Excruciating pain. I mean, can't sleep, awake all night. The pain was constant. It never left, but you got so exhausted from feeling the pain that you would finally fall asleep. I would finally fall asleep anywhere from an hour to 2 hours at the max. And 2 hours was a gift. And that's all night long. I had to sleep in the room by myself because I would have kept my wife awake all night. I was just miserable, the most misery I've ever felt.
I met your wife. She's a lovely lady. She's by your side all the time.
Yes, sir.
It's hard when you have so much pain. It takes a toll on you, but also your loved ones.
Yes, it does. And she's been a God's gift. I will say that.
Now, how does she feel about your surgery you had yesterday?
She's very happy for me. She's been through every day of it. And this started before Thanksgiving. And we are 3 days from Christmas. And I'm going to have Christmas without pain. Thank you, God. Thank you, doctor. Thank you,
welcome.
everybody in the staff. This staff is unbelievable. Nicest people I've ever met.
Well, we care about people like you. We want you out of pain and happy and getting on with your life. And tell me about your job. You have an interesting job.
I do. I love my job, and I call it the greatest part-time job in the world. One of the highlights of my job is something I can say about it is it's a job where you can say no to work. Day. It's the only job in the world that I know you can do this. I'm a stagehand with the International Alliance of Theatrical Stage Employees out of New York, and I love my job. I do everything from entertainment, theaters, arenas, to trade shows.
What's the best show you did?
I've worked with two out of four Beatles. I've worked with, everybody from Kenny Rogers to Celine Dion. I've worked with Van Halen. I've worked with all big entertainment. And then I've done a lot of medical trade shows, so I know where I'm at. When I come into a medical facility, I look around and go, oh, I know where that comes from, and I know where that comes from. And it's a great job. It's a wonderful, wonderful job. I see things before normal people see things. I saw the first flat screen computer and I didn't think too much of it because I wasn't a computer person. Now it's like, look at the flat screen TVs and it's a great job. That's the trade show side, the side where what keeps our country moving is people buying and selling the products that we use, from the cameras that are on us right now and the lights that are on us right now to doctor's coat that he's wearing and the shirt that I'm wearing. So
and probably some of the equipment we used in your laser spine surgery.
Absolutely. The best shows I do, I have to say, are the medical shows because I go around and I get literature and I read and I learn from past experiences with herniations. I've had double hernia surgery, so I know about that. I've had hand surgery, I've had knee surgery, now I've had back surgery. So I learn and it's, you get to talk to the people that do the work and represent the products, and it's pretty awesome. So I love my job. I miss it. I honestly miss it.
Well, now you're going to be able to go back to work without that pain.
Oh, thank God. Thank you. Thank you, Doc.
You're welcome. Is there anything else you want to say to your fans out there?
If you're having issues, any kind of issues with back, knees, joints, you need to come to Deuk Spine. You just have to. The Institute is wonderful. Everybody here, there is no negativity in this building whatsoever. It's unheard of out there. And I've seen a lot of doctors over the years for different reasons, but there's no negativity here. It's all positive and you leave positive. So I'm very, very happy that I did this. And I tell anybody that has ever gone through any kind of pain, you need to come see Deuk Spine. People come from all over the world, and now I know why. I just came from up the street, so I can tell you, up the street or from another side of the country, just come to Deuk Spine. That's the best I can tell you.
Well, thank you for sharing your story. Congratulations and Happy New Year.
Happy New Year and Merry Christmas to the whole staff. All your people are excellent, to your family as well and their families. And I hope everybody has a wonderful Christmas. And by the way, the office is magnificent. That is the best I've ever seen. That shows when you walk through this office for Christmas holiday, it's all about family. It's all about the holidays. It's about the people that come through.
Thank you.
Thank you
very much. All right, what a great testimonial from one of our patients who underwent surgery here at Deuk Spine. We have a lot of patients every year that come here from all over the world because they're having back pain or neck pain and they want to get out of pain. And we have the technology and treatments that nobody else in the world has to safely and effectively and permanently eliminate back and neck pain. We just finished the Deuk plasma rhizotomy. And what is that? Well, let me show you. I'll use a model. Never mind the screws and rods, not this patient, but the facet joints, and there are paired joints on the sides of the spine. These joints can be injured and become painful. The nerve that goes to those, the pain nerve that goes to the joint comes right over the transverse process, where the transverse process meets the superior articular process, and you can see it on the AP X-ray because the pedicle is there. And what you have to do is destroy the nerve in this valley right here. Can you see that, Henry?
Yes, we can.
Yeah, and that's what we did. It's not really brain surgery. You like that? Not brain surgery?
Mhm.
But it's done by a brain surgeon at Deuk Spine. We've never had a failure. This surgery works amazingly well, and patients have permanent relief. It never comes back. We have perfected the rhizotomy that other doctors cannot perfect because they're not using the right tools or the right technique. And I pioneered that technique and tools here at Deuk Spine. It's called the Deuk Plasma Rhizotomy. Okay, let's take questions.
We have a question from Francesco, once more on YouTube,
All right, Francesco.
asking how is the plasma different from the ablation? Is it the size of the area that is able to be treated?
Good question, Francesco.
Francesco, yeah.
Where is Francesco from?
That is a good question. I would assume Italy, but also.
All right. Well, Francesco, great question. So, if you understand the current treatments for facet joint pain, it's called the radiofrequency ablation, RFA. And what's done is the pain doctor will put a skinny little needle down right to where I showed you the nerve is, and they will heat the tip of that up to 80 degrees Celsius and let it burn for about 60 seconds. The problem is that pain nerve isn't where they put the needle. It's usually to the side, either left, right, a little bit further. And burning in that area will either partially damage that nerve, but the nerve grows back, or it won't damage it at all. It'll just cause some swelling around the nerve in the soft tissue like the muscle or the capsule, and then those things heal and the pain comes back. So what I, as a neurosurgeon, realized the only way you get a nerve not to come back is by cutting the sheath completely, and that's what we do. Yeah.
As of that, no current questions. That's it.
Okay, thanks for joining us. We will be back shortly with the last surgery for today. It is called a piriformis muscle release, a Deuk piriformis muscle release. Once again, I pioneered a new way to do it, a better way to do it than it's been done. Piriformis muscle lives in your butt cheek. It's in the top half. It connects from the sacrum over to your hip. And it is the third most common cause of chronic back pain after the disc, the facet, then there's the piriformis. The fourth is the sacroiliac joint when you get inflammation. By the way, with the SI joint or sacroiliac joint, they just published a study out of Europe that shows patients that get the fusion of the SI joint for SI joint pain, they don't do any better than people who don't get fusion and just live with the pain. Crazy, huh? But I knew that already. Sacroiliac joint fusion doesn't work. Don't get an SI joint fusion. We've done one of them here. It didn't work at Deuk Spine. I don't believe in doing treatments that don't work, but doctors are recommending it all over the world because they make a lot of money doing these SI joint fusions. What is the SI joint? Well, it's where your tailbone here connects to your hip bone. And there's a joint on the left and the right. You see it better right there and right there. So if you've got arthritis in those joints because you injured it, a lot of people will tell you to get a fusion. Don't do it. They don't work. Come to Deuk Spine instead. We do a 5-nerve Deuk plasma rhizotomy. We deaden the 5 nerves to the joint, and that takes the pain away permanently. Okay? So our next patient has a piriformis syndrome. And he's interesting because he had laser surgery on his discs already, and he had facet treatments on his facets, the Deuk plasma rhizotomy already, and he had sacroiliac joint rhizotomy already, but he came back with horrible pain in his butt cheek. Actually, he had it before surgery. I told him to get it fixed. He didn't want to do it, and he went home This is 2 weeks ago. Now he's back and he's having the same pain in his butt cheek. I told him he needed a piriformis muscle release. He's getting it done today, and we'll be broadcasting that in about 20 minutes. So come back for our second live stream or third live stream of the day, which will be a right piriformis release. Once again, at Deuk Spine, I pioneered a new way to do it. The old way of doing it, you would cut the entire butt cheek about that big. You cut right through the gluteus maximus. You find the piriformis underneath with the sciatic nerve, and then you cut the muscle right in the middle of the belly. Very dangerous, very painful, long recovery, and it doesn't work half the time. So I pioneered a new way to do it, releasing it off the top of the hip. Again, it was my technique after studying patients and their results and studying the anatomy of the patients and figuring out the safest, best way to do this procedure was to detach the muscle at the hip. And we do all that with x-ray guidance. So we'll be doing